So to describe an athletic trainer, basically it's an allied healthcare profession that's trained in multiple assets. You know, it's injury prevention is first and foremost, but we're also kind of the first ones on the scene. If an injury does occur, we can evaluate injuries. We can come up with a good treatment plan for an injured athlete. We can help them deal with their injury, both physically and mentally.
I always knew I wanted to be in athletics and some sort of medicine field, but I wasn't sure what. And so I really liked interacting with the athletes, learning how to tape and do all the things that just being in the athletic training room and interacting with everybody.
It's not uncommon for an athlete to go through like a grieving process, especially if they've never been hurt before. That's not uncommon, and it's important for us to recognize what they're going through and refer them on to, you know, professional help if they need to, and recognize that. That's become a very big piece recently, and just trying to recognize the psychological needs that they have as well.
So when I first get to work, the first thing I do is dedicate about an hour to doing documentation, updating injury reports, chasing down coaches to give them updates on their athletes. And then once the sports hour starts, I prepare everyone who can practice for practice. And then the student athletes that aren't able to practice stay behind to do therapies, rehab modalities, anything that might help them along with the process. And then after school lets out, I have my second wave of practices. And so I do that all over again, eventually to the end of practice or until a game starts. And if we have a game that night, I'm also prepping for that game.
So during a game, you're always on alert, head on a swivel is what we like to say. If someone takes a hard hit in football, you kind of are watching how they get up, what the next play happens. A lot of times if someone's running with a different gait than their normal, it's really about getting to know your athlete so you know their normal and their baseline so you can spot if anything is out of the norm for them.
Things have changed in the last 26 years. You know, we're much more educated. We've learned a lot more about injuries, long-term effects of the injuries, and you know how to rehab a lot better, and evaluation skills. And you know the game has changed. The kids are bigger, faster, more physical, stronger. So there's a lot more injuries involved in the game, I feel like, than there probably was before.
The most rewarding part of my job is seeing athletes come back from injury. When they first get their first touchdown or bucket after something happens, you kind of feel like you've helped them do that, get them back to a place. And so you get to share in those victories and those wins. You feel like you're a part of that.
It's not for the faint of heart. It's a lot of hours, it's a lot of time, it's very demanding, but it's also very fulfilling and very rewarding.